So what medications do you use during an epidural? Okay, so the first thing is when we're trying to find the space, you can actually use two different types of loss of resistance syringes. There's a glass one, but a little fancier, and then the plastic one. And so when you're utilizing that, I will use sterile water, actually that's inside of here. So we put that in here, and that is what helps us to make sure that we're actually in the right spot. Once we've already threaded the little catheter, which looks like this, and it goes inside, then we actually do what we call a test dose. Test dose is to make sure that we're in the right spot. We have to be in the epidural space. We do not want to be in the spinal space, and we do not want to go inside of a vessel. So we use this is lidocaine, and it's actually 1.5% with epi. The reason why we do that is because if I were to give medication and test it inside of a vein, let's say that this catheter was inside of a vein, guess what would happen? You would get ringing in your ears, you'd get a metallic taste in your mouth because of the local anesthetic, and your heart rate would start beating really, really fast because of the epi. Now, secondarily, the reason why we use 3 cc's of it is to make sure we're not in the spinal space. And if we were in the spinal space, your legs would go numb, completely numb. But don't worry, it is completely reversible. But again, that's how we determine with what we call a test dose. And then usually for the skin wheel, or for what we actually give for numbing medicine, we use local anesthetic, also called lidocaine. Now, once you have a beautiful epidural place and you're all feeling good, you want to make sure that you are being given enough local anesthetic. And so the local anesthetic that we choose to use is called bupivacaine. And bupivacaine is another family member of lidocaine, but it's great because it doesn't have as much motor blockade. And the reason why we need that is because you need to push when you are actually delivering itself. So that is all the different type of medications that we put. Another thing that we can add is fentanyl and or Duramorph, something that both of those are pain medications that we can use, especially when it feels like it's too much pressure. Remember, an epidural can only take away pain because it works on the mu receptor, not pressure. So lots of pressure is birthday time. Happy birthday to you. And if you want to not puke, I know I didn't want to. This product is called NoMo Nausea, and it's found at labor and deliveries all over the US. It is incredible. It's a wristband that you actually smell anytime that you feel sick, and it instantly stops you from getting sick. So you can actually go buy one if you're gonna go on a cruise or something, but make sure that it's inside of your baby or hospital bag, and you don't want to puke, because trust me, when you puke and you're laying down, so not fun. Happy birthday.